let's put the two videos. We promised to two persons that spend a lot of resources to do it from Nigeria.
To introduce Luiz Augusto.
Yeah.
We are networking in a transversal way, not with the friends. We are networking with the cohabitants that are in our right and our left. But we are networking as well in a longitudinal way with the ones that were behind us and the ones that are coming afterwards. To have Luiz Augusto is a privilege, because actually I have to mention as well the seminar, the workshop we organized with Andorra, that actually was something before this chapter, and was actually the beginning of this journey to put in value the ones that are doing, the doers, the ones that have validated. We have to continue to publish about estimations, about correlations. I think we have to publish more about the ones that are having impact and put that in value. So it's why both Celades and Luiz Augusto are two very good examples.
3 years ago, 3 years ago, we did an amazing conference in Andorra, thanks to Dr. Piquet, that was at that moment the director of the Andorran healthcare system. And we launched the international Planetary Health Conference in Andorra. It was quite a germinal moment from this after moment. No? So that's true. And Gutu, Luis, made an amazing speech that we fell in love with that. No? And it was your teacher also. So let's finish with start with Celades and finish with Gutu. Yeah.
Morning, good afternoon. My name is Dr. Eduardo Celades. I am the Chief of Health of UNICEF in Nigeria. As you may know, UNICEF is the UN agency that has the mandate to deliver services and to ensure the rights of children and women across the world. Here in Nigeria, we have a very extensive presence. And what we are trying to do, in my case, is that the children have access to health. How this looks like in practice, it's complex. It's a country with a lot of inequities. It's a country facing climate change, disasters, etc. So today, I'm going to talk about how we're using innovation to really change the way that services are delivered. And this is basically how we are transforming the air in oxygen using solar energy, and how this oxygen is used to treat pneumonia and to save lives of newborns and children under 5. I have a presentation now that I'm going to share with you. So now I'm going to talk about the oxygen gap and what is the situation of children under 5 and newborns in Nigeria. Nigeria is a huge country. Every year, more than 8 million children are born. However, under 5 mortality is more than 100 every 1,000 live births. It means 1 out of 10 children are going to die before the age of 5. And why is that? What are the main causes? So are the typical 3 main causes that we see in many low-income countries, low and middle-income countries. And this is pneumonia, malaria, and diarrhea. So today, I'm going to focus in pneumonia, right? So we know in Nigeria, up to 950,000, we have almost 1 million deaths every year of under 5. And many of them are preventable, especially because of pneumonia. So this is the problem that we had. How we decided to address that, how we decided to address these more like 100 deaths of children every hour. So we decided to focus in one very specific problem and to look at it from an innovation perspective. One big issue that many low and middle income countries face is that the hospitals, the primary healthcare facilities, they don't have oxygen. So it means that when a child has a pneumonia, has an infectious respiratory disease, has the respiratory distress, doesn't have the oxygen to breathe. So we're thinking, okay, what is needed to move a huge country like Nigeria, more than 200 million people, to really be able to transform the air in oxygen and the sun and the energy from the sun in actual power to power the plants. So we did 3-level steps, 3 innovations, all in one, that resulted in the results that I'm going to share with you. The first one is like how we can plan. How do we know where the oxygen is missing? So knowing that pneumonia is the #1 infectious killer of children in Nigeria, we knew that medical oxygen was going to be one of the most important interventions. But we needed to be able to to map it, right? To explore the needs and to see really how we can do something that we can scale up, right? So that was our first thinking, how to develop an investment plan and a scalable plan to deliver oxygen to the children. The second one was how to make that accessible. So the first one we did, it was a mapping to know where the oxygen was needed. The second one was to try to develop a solution, how we can ensure that in Africa, in Nigerian remote communities, have the oxygen we need. So we thought in having an oxygen plant in a box, something easy that really can serve the population. So a very easy technical solution to do that. And the third one was like how we can ensure that, knowing that we don't have fuel or we don't have enough oil, so how we can ensure how we can power these plants. And this was the powering the oxygen systems. So basically, these were the three ideas that we have: conducting a mapping, developing a tool to know the needs of oxygen. The second one was to develop a technical solution, how to produce the oxygen. And the third one was to make it with solar panel. I have to say, at this moment, we have fully functional 9 oxygen plants, already few of them fully powered by solar panel. As per our knowledge, is one of the first ones in the world. So let me just show you, for example, how we did that, right? We launched an engineering contest to be able to look for solutions. The plants should be easy to maintain, should be easy to install. The capacities are very low. They should have like low maintenance, etc. So what we did was the challenge. I will stop now with the slides. Now we are going to see a video where we can see this in practice, right? So basically, what we have done is to transform the energy of the sun in solar energy, and this solar energy has transformed the air in oxygen, and the oxygen goes to the lungs of the newborns. So jointly with the oxygen work, what we have been doing is to have newborn units. Remember that 1 out of 3 deaths of children under 5 are newborns, children just before 4 weeks. So what we are doing, and you can see in the images, is how this oxygen flows, how we have nurses, how we have midwives, that they are saving the lives of these children. We really believe this is going to have a huge impact, reducing under 5 mortality and newborn mortality in Nigeria. Innovations like this are easy to conceptualize, perhaps, but the main challenge is how to scale up them, how to make them at a scale and then sustainable. But I believe like examples like this as from UNICEF are as well replicable in other contexts. Thank you very much for your attention today.
Queridos Pedro, Jorge, muito obrigado pelo convite para estar com vocês aqui hoje, discutindo um assunto crucial: como podemos alcançar a equidade em saúde e o bem-estar do planeta trabalhando juntos. Como vocês sabem, hoje enfrentamos desafios complexos, mas com inovação e colaboração podemos construir um futuro sustentável e saudável para todos. Vejam o que aconteceu recentemente aqui no Brasil, no Rio Grande do Sul, com essa enchente, um fenômeno climático, uma crise climática, fenômeno esse associado com todas as mudanças que estamos sofrendo no mundo, causados pelo próprio homem, e como foi importante a colaboração e a liderança da ministra Anísia para poder lançar mãos e imediatamente salvar vidas. Foram salvas inúmeras vidas por causa da ação imediata e da colaboração. Mas também vamos aprender nos próximos meses, quando formos analisar a resposta, os pontos que podemos melhorar. Podemos melhorar com a nossa colaboração científica, com inovações, com novas maneiras de fazer bem para o planeta e para a saúde das pessoas. Principalmente aquelas pessoas que vivem nos rincões mais pobres, que vivem naqueles lugares mais vulneráveis e que, portanto, no dia a dia já sofrem muito e têm muitas dificuldades para poder manter a sua saúde. durante uma crise planetária, seja ela climática, seja ela da biodiversidade, seja do que for, eles vão sofrer mais e primeiro. Então, pensar neles, pensar no planeta, é pensar na saúde de todos, é pensar no bem-estar de todos. E nós, da comunidade científica, eu tenho certeza que aqui eu falo por todos os cientistas que poderiam estar aqui com vocês nesse momento importante de chamado, temos como contribuir. Vamos trabalhar juntos, vamos entrar nessa empreitada, vamos apoiar essa nova iniciativa e vamos trabalhar todos esses conceitos: saúde planetária, ecossistemas, essa mudança climática, as questões, o planeta saúde, como agora está sendo chamado, saúde única, tudo isso vai nos ajudar a descobrir novas formas de salvar vidas. E mais que tudo, de promover a equidade e ter uma sociedade melhor, mais saudável, num planeta muito saudável que ainda vai estar por nós por muitos e muitos anos. Mais uma vez, muito obrigado. Contem conosco para essa empreitada. Um abraço.